Hello everyone, I'm a doctor, and today I want to talk about a topic that's incredibly important for family planning, the coil. COO, or as we medically call it, the intrauterine device, or IUD. Many of you have asked about this method, so let's dive into what it is, how it works. I'll separate the facts from the fiction. So, what exactly is an IUD? It's a small, T-shaped device that's placed inside your uterus by a healthcare professional to prevent pregnancy. It's a long-acting, reversible contraceptive, which means it can work for years, but you can have it removed whenever you decide you want to get pregnant. There are two main types. First, we have the hormonal IUD. This type releases a small amount of the hormone progestin, which thickens the cervical mucus to block sperm and can also prevent ovulation. Depending on the brand, it can be effective for 3 to 8 years. The second type is the non-hormonal, or copper IUD. This one is wrapped in a tiny bit of copper, which creates an environment that's toxic to sperm, preventing fertilization. The copper IUD can last for up to 10 years. Now, let's talk about the pros, because there are quite a few. The biggest advantage is its effectiveness. IUDs are over 99% effective at preventing pregnancy, making them one of the most reliable methods out there. They're also incredibly convenient. Once it's in, you don't have to think about it daily or monthly. For hormonal IUDs, another big plus is that they can make your periods much lighter and less painful. And for some women, their periods stop altogether. With the copper IUD, it's a great option for those who prefer or need a hormone-free method. Of course, like any medical procedure, there are cons to consider. The insertion process can be uncomfortable or painful for some, often described as a strong cramp, though it's very quick. For the first few months after insertion, you might experience irregular bleeding or spotting. With the copper IUD, your periods might actually become heavier and more crampy, although this often improves over time. And while rare, there is a small risk of the IUD coming out on its own, or, even more rarely, causing a perforation of the uterine wall during insertion. Let's bust some common myths. A big one is that IUDs cause infertility. This is simply not true. Once your IUD is removed, your fertility typically returns to your personal normal very quickly. Another myth is that you or your partner will feel it during intimacy. When placed correctly, the IUD is inside your uterus and the strings are trimmed short, so it shouldn't interfere at all. So, what's my overall view as a doctor? I think IUDs are a fantastic option for many people. They offer long-term, highly effective, and reversible contraception with a set-it-and-forget-it convenience that's hard to beat. The choice between hormonal and non-hormonal depends on your personal health history, preferences, and what you're looking for in terms of menstrual side effects. The most important step is to have a thorough discussion with your doctor. They can help you weigh the pros and cons based on your individual health and lifestyle to see if an IUD is the right fit for you. Making informed choices about your reproductive health is empowering. Thanks for watching today. I hope this cleared things up. If you have more questions, drop them in the comments, and don't forget to subscribe for more health information. See you next time.